Today we'll talk about the vascular instruments, the instruments that are used in the vascular surgeries, and then we'll talk about the imaging, including mainly the CT angio and some information about the duplex. First, about the instruments. The instruments in the vascular surgery are specialized instruments used to handle the vessels with care to avoid any injury or contusion. First, this is what is called a bulldog vascular clamp. Bulldog vascular clamp is a type of the vascular clamp, has a specialized design to clamp on the vessels, including the blood flow during the operation without injuring or causing any harm to the vessel. So this is a type of vascular clamp used for clamping the vessel during vascular operation to achieve a bloodless field during the intervention in the vessels. This is the DeBakey vascular clamp. It is also type of the vascular clamps, has the same function as the previous vascular clamp, used also to control the blood flow to achieve a bloodless field for the vascular operation and intervention. This is the Satinsky vascular clamp. It's a vascular clamp with a special design used for clamping the vessels also without injuring the vessel wall, and with its special design it can be used to isolate part of the wall of the major vessels for intervention without including the lumen of the main vessel. Then this is the DeBakey vascular forceps. The DeBakey vascular forceps is the forceps with a specialized teeth that is used to handle the vessels in the vascular operations without causing any harm or injury to the vessels. This is the basic tool that is used in vascular surgery to handle the vessel during the operation. Then we have the Fogarty catheter. This is a catheter with a balloon at its end, used in the embolectomy and thrombectomy operation. This balloon can be inflated and deflated, and it is introduced in the vessel, then inflated after the level of the thrombus, then it's drawn to sweep the thrombus from the vessel to achieve in the operation of thrombectomy and embolectomy. Then this is the stripper. The venous stripper that is used in the varicose vein operation, varicose vein stripping operation. It's a metallic wire with screws at both its ends. One end there is a handle that is applied to it, and the other hand we can apply and produce a small head to be introduced in the vessel till reaching the other end of the vein, then changing the heads with a larger head for stripping. Then this is the Potts scissor. The Potts scissor is a scissor that is especially used in the vascular surgery, has a special design in its small and curved blade to help in achieving arteriotomy in the anterior wall of the vessel without injuring or touching the posterior wall. So these are the main vessels and the main instruments that are used in the vascular surgery to handle the vessels and in the vascular operations. Then we will talk shortly about vascular imaging. The vascular imaging is very important to visualize the vessels, indicate the flow of the vessel, indicate any pathologies in the wall of the vessel or inside the lumen of the vessel to achieve a proper diagnosis and then proceed to treatment. There are two types of main modalities in the vascular imaging. First, we have the duplex. The duplex is a combination of the detection of the Doppler wave, which detect the movement of the RBCs and translate it as sound waves, and the normal ultrasound that visualizes the tissues by ultrasound waves. By combining these two modalities, we have the duplex. The duplex is used to visualize the tissues, then it will visualize the vessels, the artery and the vein, visualize the wall of the vessel, the diameter of the vessel, and the lumen of the vessel. Then by applying to detect the Doppler wave inside the lumen of the vessel, it will detect the movement of the RBCs, giving it providing the sound of the movement of the RBCs by the Doppler wave, and also providing a color impression on the blood flow, either red or blue. This allows detection of occlusion of the vessel, allow detection of injury of the vessel, and dilatation of the vessel. This is the image that is detected in the Doppler wave with detection, and we have the Doppler wave. The sound wave is either triphasic, that means that it has three phases. This means that the flow is strong enough in the arterial flow, and the wall of the vessel is healthy, allowing the dilatation of the vessel during the systole, then its recoil during the diastole. If the flow is weaker or the wall is atherosclerotic to a certain degree, the flow becomes biphasic, two waves. That means that the flow is strong enough, but there is no recoil in the arterial wall. Weaker flow or a very atherosclerotic wall of the vessel leads to what is called monophasic flow, which is a single wave flow, only a flow passing singly during the systolic phase. That means that there is a severe atherosclerosis with or markedly decreased arterial flow. Then we have the CT angiography. The CT angiography is achieved by taking first an image of the body with a CT plane, then injecting a dye in the body. When the dye reaches the arterial tree, before reaching the venous tree, another image is taken, and then both images are subtracted from each other, leaving only the dye and the lumen of the vessels to be reconstructed in the form of the arterial tree. So the CT angiography gives an impression on the lumen of the vessels. This is an image of the normal arterial tree with all its details. In cases of pathological lesions, they appear as filling defects. The lumen, the vessel may be attenuated, narrowed or occluded, and the occluded vessel part will appear as there is a part of the normal vessel that is missing. And due to the presence of collaterals, mostly there is what is called a distal runoff. That means that the patent vessels that are after the level of occlusion will be filled with dye and will be detected. So this is what is called this is the flow that is detected after distal runoff. This is what is called a distal runoff. This is important to plan what is the operation for these patients and to revascularize the vessel at which artery. So first, what is the difference between the acute ischemia and the chronic ischemia in the forms of the CT angio? In cases of chronic ischemia, the vessels usually are severely atherosclerotic with marked attenuations and narrowing and bleeding of the vessels all over the arterial tree, indicating the severe degree of atherosclerosis. Then we have part of the vessel with complete occlusion due to the atherosclerosis. So this is occlusion is gradual narrowing, starts by gradual narrowing of the vessel, reaching to complete occlusion of the vessel. So this is chronic ischemia. Also, this is a form of chronic ischemia in which there is atherosclerosis occluding the aorta and both iliacs. We have multiple collaterals leading to distal runoff on both femoral arteries, but there is a complete occlusion of the distal aorta and both common iliacs. This is what is called aortobiliac occlusion. This is another form of, this is another image of a case of chronic ischemia, in which there is a total occlusion of the whole length of the left side superficial femoral artery. In this image, you'll find also that the vessels are unhealthy, with atherosclerosis and bleeding all over the arterial tree, with gradual narrowing and then occlusion of the superficial femoral artery to be totally occluded along its length. And then there is distal runoff at the popliteal artery above the level of the knee joint. Then we have the abdominal aortic, and this is an abdominal aortic aneurysm. There is a dilatation in the abdominal aorta below the level of the renal vessels. This dilatation is a pathological dilatation. We identify that it is aneurysmal by increase more than 50% of its normal diameter. After, if it reaches a certain level, or if it shows complication, it requires intervention to avoid sudden complications like rupture that can lead to sudden death. So this is an abdominal aortic aneurysm involving both common iliac vessels. This is acute ischemia. Acute ischemia is identified by that most of the other vessels will be healthy, with no atherosclerosis or bleeding in it, and also the level of occlusion, at the site of occlusion there is an abrupt occlusion. There is no gradual narrowing than occlusion like the chronic ischemia. There is abrupt occlusion due to the presence of an embolus or thrombus at this level. So in this case, there is an abrupt occlusion in the distal superficial femoral artery, including the popliteal artery, and with distal runoff on the tibial vessels, mainly the posterior tibial artery. Thank you.